We've seen record COVID-19 cases here in the Bay State, numbers surpassing 1 million due to the infectious Omicron variant. But what could this mean as we look ahead to 2022? Well, tonight we're getting answers and insight from one of our local health experts.
I would encourage people now to be cautious. We have a very challenging, what I would consider to probably be 4 to 8 weeks ahead of us with surging infections.
Dr. Robert Roos, Chief Medical Officer at Mercy Medical Center in Springfield, is urging caution this week and in the weeks ahead. Surging COVID-19 cases in the community is taking a toll on area hospitals.
Any given day, we are operating at a level where our capacity is nearly or fully reached.
Taking a look at the numbers in the days following the Christmas holiday weekend, a steady climb in the positivity rate. On Monday, nearly 13,000 cases and over 9% positivity rate. Tuesday, more than 9,000 new cases with a positivity rate just over 11%. And Wednesday, just over 15,000 new cases and a nearly 14% rate of positivity. That is more than triple the number of cases reported last year at this time when the positivity rate was just over 7%. Dr. Roos tells Western Mass News he worries about the rise in infections.
When you have that many more new infections every day, that will ultimately, a percentage of those will result in severe illness or individuals needing care in emergency departments or in hospitals. And that is the concern about overwhelming the healthcare system.
And he says staff shortages are a major issue.
In certain units or in certain departments, we may have an open position rate of about 10 or 15%. When we have that many open positions, as you can imagine, what it does is it means that the folks that you do have work even more, right? So we provide care in different ways, and the folks that we do have end up picking extra shifts and extra hours. And that can take a toll as well.
Looking ahead to 2022 and beyond, Dr. Roos says the staffing situation is critical.
This is something that I am concerned about healthcare dealing with, not just for the next 1 or 2 months, but for several years, with the way that the workforce, challenges have persisted and the labor market has really changed.
One thing that gives him hope, preliminary reports showing the Omicron variant has resulted in far fewer severe illnesses.
This is a highly infectious variant of this virus. If it was also incredibly severe, we would be in a very precarious situation as a community and as a healthcare system.
As for his overall expectations for the year when it comes to COVID-19?
I do think 2022 will be a brighter year. I do strongly believe that there are many medical and scientific advances that we can look to show that we have better treatments, we have vaccines, we will have an oral outpatient therapy that's available for people that can help reduce the risk of hospitalizations. And there will be a time when this virus is thought of much more similarly to the flu than it is right now.
And currently, members of the Massachusetts National Guard have been activated to assist hospitals in the state struggling with staffing issues due to COVID-19, including right here in Western Mass.